Ophthalmologist Dr. Hazel Schilling-Federickitz has stated that despite the efforts being made to enhance eye care in Dominica, there is still room for improvement. And she said that one of her main concerns with regards to glaucoma is the lack of availability for free medications for the elderly. Schilling-Federickitz made this comment during an exclusive interview with CBN4 in observance of Glaucoma Week.
There yet. One of my concerns, especially with glaucoma, is the availability of the eye drops that lower the pressure the best. They are still not available free of charge. So if you're diabetic or hypertensive, you get your medication in the health center pharmacies and it is free of charge to you. With us, with where glaucoma is concerned, the patients still have to buy most of their medication. And yes, the government has assisted by having these medications sold at cost price, meaning that there is no profit on what they are charged. But they still have to come up with the money. And most of our glaucoma patients are elderly or older persons who are not working, their pension is small, and they have to buy this medication every month for the rest of your life, because glaucoma is a disease. Once you have it for life.
And she made reference to elderly persons who are living in the distant communities struggling to purchase their medication.
No, because they have to pay for it. The system to do that is only at the hospital. And so if you have an elderly person in good hope that have to buy this medication.
Schilling-Federickitz added that another disadvantage of the elderly paying for their medication is that the responsibility becomes overbearing, and many of them eventually go blind and have to be placed in homes like the infirmary.
You can help them to preserve their vision. We'll also be helping them to continue their independent living. And so I am still appealing that we reconsider and provide these medications free of charge so that all the patients can access the glaucoma medication throughout the island.
And persons can access the eye care clinic at the Princess Margaret Hospital through referrals from a family nurse practitioner or a district medical officer, which should be brought to the record department at the PMH to make an appointment at the eye clinic where they will be screened. Persons over 60 and children below the age of 18 will receive free screenings, while people between the ages of 19 and 55 are expected to pay $25 for the first screening and $10 for the subsequent screenings. A number of organizations over the years have come on board to enhance eye care on the island, namely the Vosh Mission, the Rotary Club, and the Ministry of Health, among others.